Hello, everyone. My name is Hartman, co-founder and CEO of Abstractive Health. As I said, I've been in healthcare 15 years. And primarily in that journey, I've seen the rise of physician burnout. So it's said in a lot of the presentations today is that computers actually weren't used in healthcare except for about within the last 15 years. So doctors were primarily using paper, 90% of them, starting in 2010, there was a huge shift to computer systems. And in that shift, there's been a rise in burnout. So doctors overwhelmingly, 78% of them face burnout. And most of the time, a doctor is in front of their computer. Like if you go to, as a patient, to the doctor's office, they are most of the time in front of the computer. They don't know potentially who you are as a patient. And that's because statistically, they're spending 2 out of every 2 hours they're putting into a computer and only 1 with a patient. And as was said, so we've been working with Weill Cornell Medicine on some research with Abstractive Health. And some of the burdens that emergency medicine physicians face, outpatient physicians, primary care, is this burden of too much time in the EHR. They also don't know ahead of time who their patients are. And a lot of that can be solved with summarization. So a little bit of history. In that 15 years that I've been in healthcare, I was at one point placed in charge of suspending doctors for not writing summaries in time. So I was if anyone who here's a clinician, I was doing deficiencies with the medical records office. And this is about 2017, 2018 at Montefiore. I come to realize that instead of punishing, oftentimes it's residents who are placed to do the discharge summaries, but instead of punishing doctors, the technology was starting to come to place where we could fully automate a discharge summary. And we are actually at that point now, in 2025, where large language models, beginning in around 2017, 2018, have come to the point from a summarization technology that they can take all of the content in the local EHR, so when you're using Epic, to create a discharge summary. And what makes language models very great for this challenge of discharge summaries, handoff notes, and pre-visit summaries is the information already exists. So when you write a discharge summary, the content is already in the progress notes. You're not supposed to put new information into these summary notes that you write. And so it's just grabbing all of that content and writing like a book report, like a cliff note. And these summary notes are critical to the patient journey, to healthcare, because when the next physician receives a summary, they can immediately know what has been happening to that patient. Without it, they'll just look at the previous note. And the previous note doesn't give like a longitudinal history of what's been happening to that patient. As med students or in your clinical journey, you're kind of taught that the patient's journey from a longitudinal sense is just as important as the individual diagnoses that you can make about the patient. Most of the diseases that we are facing in the United States are chronic in nature. So there's obesity, CHF, diabetes, and often if you can understand what's been happening to the patient of their journey of these diseases, you can make better care. And with a summary, you can understand pre-visit, handoff discharge summary, more about that patient. So I've been at it for about 4 or 5 years. Like I said, I recognized this challenge about 2018, and then I went back to grad school at Cornell Tech. Initially did research on the discharge summaries, and we spun it out into a company, Abstractive Health, about 3 years ago on the focus of doing summarization. And so from a future standpoint, I can tell you in the next 2-3 years, you guys will not be having to write discharge summaries. You will not having to write pre-visit summaries or any, these summaries are going to be automated from a future standpoint. And some of the challenges that are particularly faced from a summarization is that the medical chart is huge, as you've heard. It's like hundreds of thousands, millions of words, and you can't feed the words all into one language model. You have to do a chunking strategy, a proprietary method approach of getting all of the individual notes, finding all of the salient content, building a comprehensive summary, and then choosing the most important content. It's still solvable because with summarization, you're not doing clinical decision-making, you're not doing inference, you're just finding the most important content. And language models are really good at this. So how the summary approach works is you first collect all of the data within the electronic medical record. You also pull it from across the US. In the last 10 years, there's also been a huge push for interoperability. And so about 2011, 2012, as we were transitioning to computer systems, there was a big pushback against some of the major EHR systems of siloing the data. And so we've created what's known as HIEs, Health Information Exchanges, so that when you go to a doctor's office in Florida, and then you come back to New York, that your information is actually a part of these health information exchanges. And so with just a patient's first name, last name, date of birth, and gender, you can coalesce and find about 80 to 90% of a patient's comprehensive history to build a summary before a visit or during the healthcare journey. Once you have all that, you can use language models to find the most salient information, build a picture, and you can do this decently quickly. So you can create a summary within 2 to 3 minutes of a person's full comprehensive journey. And then in building upon the summary, you can hit up key things that help a clinician, such as history of present illness, social history, family history, medication labs. We've been taking an approach of a general summary for emergency medicine, primary care, but you can do this approach specifically to physicians. Each one has an ideal of like what their summary should look like. Some physicians want more of that holistic view. Others want to get more granular to specific data. Both can be solved. You would use a different approach for both. Language models themselves, you can't just feed the whole chart into one. You have to do a proprietary approach. There's that I was mentioning, take data from health systems, fine-tune the models, and perfect it so it works well for the summarization strategy. You can then put these summaries into the EHRs. So we have a Smart on Fire app. Again, over the last 10 years, there's been a push to not make everything within the EHR itself, to create a marketplace of apps. And so you can put these solutions in all the EHRs, and so that the physician just clicks a button, and then it opens up an application for their summary. And then these summaries that you can produce are explainable. So you can have every sentence that you produce link back to the source information. So, and if you use other AI tools like Perplexity AI or ChatGPT is starting to do this now too, that they'll do like citations so that you understand where this information comes from so you can build trust. And so then, for example, this patient up here broke their ankle playing basketball. So you could see that this happened in a X-ray or ED note and go back into it. And so then the core components that are needed for when you do summarization, as I was mentioning, you retrieve all that information, you scan all the content, and then you build a summary. And this isn't just for text, like structured text or unstructured text. You can also do OCR. So like about 10 to 20% of the documents in healthcare are PDFs. And so you can bring those in from scans, read the content, get like short sentences from the x-rays and the impressions, and build that into the full-on pre-visit note that you want your outpatient or emergency medicine physician to have access to. And so you can see in the screen that like you can have like the scribbly doctor handwriting. You can't even read because it's very small right here, but then you can have the medications and they can be visible within your summary. And so where the future is going is that summaries, you won't have to write anymore, that they'll just be there, and then you as a clinician will spend about 1 to 2 minutes doing a brief review of them, seeing that, is this the sort of note that I want to write? and then you'll post it back into the EHR, and that becomes part of your future note. So thank you.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.